Do you ever notice that one eye seems smaller than the other? Or sometimes people say that in pictures it looks like one eye is a little bit smaller than the other, or when they smile. That could be something called ptosis. So ptosis is drooping of the eyelid. It doesn't have very much to do with the skin, but really with drooping of the eyelid, sometimes where it looks like you're almost half asleep. People sometimes say that it makes it look like their eyes are tired or their eyes are small. But in reality, what it is it's detachment of that muscle that lifts the eyelids so that when you lift your eyelids open, they don't get as high. That is what ptosis is, and that's what I'm going to talk about in this video. The one thing you need to know about ptosis is that it can be treated. I can't tell you how many times I've had people come to my office. I tell them that they have ptosis and that there's a surgery that can fix it, and they're shocked that there is actually a procedure that can tighten that muscle and fix the fact that one eye is smaller looking than the other. And that always surprises me because to me it's obvious that there's a procedure, but that's because I do it every day. What I've learned from my patients is that it's not that obvious that there are actually treatments to fix the drooping of the eyelid. The cause of ptosis is not often that obvious. Sometimes it's because if you've worn contact lenses your whole life, what can happen is that the contact lens sitting on your eyeball, as you blink every day and open your eyes and close them, the back side of the eyelid, if you imagine the back side of the eyelid, the eyelid part that you would kind of flip out for the kids that were on the playground when you were a kid, that side of the eyelid, if it constantly rubs against kind of that edge of the contact lens, what it's going to do is it's going to wear away at that muscle that helps you lift the eyelid. And slowly over time, that muscle will just pull off of its attachment or its footing so that every time it tries to pull your eyelid open, it's like it's dragging, as opposed to if it were snapped tight, it would just pull right with it. That's one cause of ptosis, is contact lens wear, especially hard contact lenses, which are not as common today as they used to be. But those were particularly notable for causing ptosis because of that rubbing effect and that friction on the edge of the contact lens. Sometimes ptosis can be caused by simply rubbing your eyes too much, because you can imagine the eyelid skin is the thinnest skin in the body, and just behind that skin is that muscle tendon complex that if you rub it enough, it's going to just slide apart from its attachment, and that can also cause ptosis. Sometimes it's related to aging, and sometimes it's related to a physical injury like a trauma, like a boxer is a very common reason why you might get ptosis, or sometimes people can get a cut or laceration there that can actually injure that muscle. So if you're new to my channel, I'm Dr. Kian Eftekhari. I'm an oculofacial plastic surgeon. I perform thousands of eyelid surgeries, and my favorite surgery is ptosis surgery. So I love talking about it, and I love helping people with it because it's so gratifying to be able to take somebody who has one eye or both eyes that are kind of half closed and have them be open again. It's like they've awoken from a dream. If you have any experience with anybody in your family that has a droopy eyelid or that you've noticed that before, please leave a comment below. I'd love to hear from you to kind of understand what you're seeing or what you've seen, because it's actually pretty common if you think about it. So I'm going to tell you a little bit about ptosis surgery today. Basically, the causes of ptosis we've kind of gone over. We don't always really figure out why, and that's not always the most important question. The real question is, can it be treated and how? Basically, with ptosis, there really are some good surgical options to treat it, and it's a pretty minor surgery. It's not a major surgery that you'd have to necessarily go under general anesthesia for. Sometimes we do IV sedation. Sometimes the surgery can be done just here in our office under local anesthesia with maybe a little bit of oral sedation, like a Valium type medicine. There's kind of two basic ways to fix the muscle, and a third way that we sometimes use for kids that are born with a droopy eyelid, which is a little bit of a different category than the ones I was talking about before with contact lens wear or rubbing the eye or just getting a little bit older and the muscles kind of stretching out as they do. So the main way to treat ptosis, the traditional way, is we go through the skin and go kind of right at your natural eyelid crease line. And you have to go through a couple layers of tissue and get to that muscle. The way I do that is after I've gotten to the muscle, I reattach it with stitches. And usually what I have people do is I actually kind of wake them up if they're sedated, or if they're in my office, we have them kind of sit up and be awake and open their eyes so we can actually see in real time how the eyelids are working. It's a little freaky, and people don't love to think about that idea of being awoken during their procedure. But sometimes we have to do that because it's our only option to be able to get that muscle fixated where it needs to be on that foot plate so that it can lift up. The way I like to kind of analogize ptosis surgery to a lot of my patients that I think makes sense is it's kind of like a Roman shade. So a Roman shade has the bar at the bottom, and then it has the fabric above it. And as you pull the string, the bar goes up, and then the fabric above it can kind of pleat over the Roman shade. So the goal with ptosis surgery is to get the eyelid muscle fixed so that the bar is elevated so that your eyes can just be more open when you're wanting them to open, instead of having to use your forehead to kind of lift your eyes open and crank them open. Or the other compensation that people sometimes do is they kind of tip their chin back because you can see a little bit better out the bottom of your eyes if you have ptosis by tipping your chin back. And over time, that can cause some issues with neck pain. And I have patients who have chronic headaches just from ptosis because their eyes are like this all the time. So they're constantly having to use their forehead. And that can lead to tension type headaches in that area just from the ptosis itself. The first way to repair ptosis is that direct approach. We call it an external approach, meaning we're going through the outside of the skin. It can leave a scar. That tends to heal very, very well, but it is an incision in the skin. The other way to fix ptosis, and the more common way that I fix it in my practice, is by going kind of in a sneaky hidden way underneath the underside of the eyelid. It's kind of gross to talk about, but when you're in the procedure, you're not really feeling anything there because the back side of the eyelid doesn't have quite as much sensation as the front skin. So what we do is we just peel one layer back, and right there's kind of an accessory muscle that helps lift the eyelid. We tighten that muscle and advance that muscle tendon complex onto that foot plate. The foot plate is something called the tarsal plate. And when we advance it onto the tarsal plate, then again, the bar of the Roman shade can be lifted up so that the eyelashes sit higher. It's really important to understand that ptosis has nothing to do with extra upper eyelid skin. They often can occur together where people will have some extra saggy upper eyelid skin. I don't have a whole lot to pinch on my eyes, but that extra skin can kind of fold over and sit on the eyelashes. And interestingly, when you fix the ptosis, like if you bring the bar of the Roman shade up, then the skin can fold over and pleat even more over the shade. And people can be a little bit more, annoyed or kind of noticing that skin in the upper eyelid where it feels heavy or feels full. And that's why I often am doing a ptosis surgery and something called an upper blepharoplasty, which is removal of skin, at the same time. Those can be done at the same time and sometimes as part of the same procedure. So that's the second way to fix ptosis. I prefer the second way because it doesn't involve a visible skin incision, and I think it gives a little bit more predictability to the contour of the eyelid, giving you that nice awake look where your eyes are bright, as opposed to that kind of heavy, tired look where your eyes are more down, or bedroom eyes is something that people often say, or sultry eyes is another analogy for what that can look like. So when you fix ptosis, it can improve the vision. So in some cases, the eyelid or the bar of the Roman shade is low enough that it's actually cutting off the top half of your vision. The way you might notice if you have that is if you really relax your forehead, so kind of relax down, and if you open your eyes just with your lashes, if your eyelashes are going straight across your pupil, which is the black dot that you see in the middle of the colored part of your eye, then there's a chance that the ptosis is actually affecting the superior half of your vision. It's not going to be like it'll affect the sharpness of your vision. You'll still see the same on the eye chart before and after surgery, but often people say that when that window shade is raised up, they feel like things are brighter. They get more light in because, as you can imagine, it's just opening the aperture of the eye a little bit more to get more light through that pupil so that the back of your eye can process the information. So ptosis definitely can improve vision, and it can also improve appearance because sometimes that heavy, tired look is just something that happens over time, and you get that kind of boost in your eyelids to where they're more awake. And I think it adds a lot to the cosmesis of the eyelids and how they appear. So those are the two main ways ptosis can be fixed, is through the skin, the external approach, or underneath the eyelid, which is called the internal approach. Sometimes kids and people who are born with a congenital droopy eyelid or a congenital muscle that doesn't work, sometimes they need a little bit more of an extensive procedure called a sling, where we actually connect the forehead muscle, the muscle that allows us to lift our forehead, to the eyelid muscle, which is kind of defective, usually on one side, so that the forehead moves as the eye moves. And that's called a sling. Not very common to do that procedure. There are some medications now that actually can treat ptosis. So one question I always get asked, is there anything I can do that's not surgery? And the answer is yes. So as of a couple of years ago, there was a medication approved by the FDA called Upneeq. And Upneeq is Upneeq. Upneeq is an eye drop that you can put in the morning or before, some sort of special event if you're going out or something like that. And it will actually cause the muscle to shorten. So you remember before we had the muscle and the foot plate and they're kind of off each other. And so you can either fix it with surgery by putting them together, or if you can just get the muscle to kind of tighten, it'll just pull that foot plate up with it a little bit. And that can work great for a lot of people. The nice thing is it's not surgery. It is an eye drop. It's something that lasts, a couple hours. I would say in some cases it'll last up to 12 hours. That's what the manufacturer says. But a lot of my patients say it doesn't last quite that long. The only downside to Upneeq is that even though it is a prescription medication, it's not one that's necessarily covered by insurance. And it can be a little bit costly to use that chronically over time. So if you're wondering if there is a medication option to fix ptosis, there is. The cost benefit of it may not be as good as surgery. And in most of my patients, it's not. Surgery is the better way to go because the surgery is fairly minor as far as surgeries go and well tolerated. So let's talk a little bit about that. What's the surgery like to go through? Well, the surgery takes about 15 minutes on each side. Whether you do it through the skin or in the underside of the eyelid, it's fairly quick. Like I said, usually it can be done as an outpatient, like in an outpatient surgery center, like an outpatient facility. It doesn't have to be done in a hospital unless you have some other health conditions that have to force you to have surgery in a hospital. Or sometimes it can be done in the office under just local anesthesia. The surgery works quite well. So over 90% success rate with that surgery in a specialty trained surgeon like myself, an oculofacial plastic surgeon. If you're looking for an oculofacial plastic surgeon, you can go to oculofacialsociety.org, or you can look up the American Society of Ophthalmic, Plastic, and Reconstructive Surgery, of which I'm a member. And that is the society of eyelid surgeons that have specialty training in this type of surgery. Basically, the surgery is pretty quick. You go home the same day, and after surgery, you're going to have about a week of swelling, maybe 2 weeks of swelling and bruising. It's important to know you're going to get bruising even down into your lower eyelids sometimes. And basically, your eyes might feel a little dry, gritty, and irritated, but you can use them. You can open your eyes. I've had lots of patients where I do the surgery and I walk out to the recovery area, and 5 minutes later, and their eyes are wide open. They have no swelling, and they're happy as can be, and they don't swell that much after surgery. But most people do swell quite a bit and have some bruising. So it's kind of important to know that you might not be your most presentable self for about a week after surgery. During that week after surgery, besides the dryness of the eyes, sometimes people can have some pink or even bloody tears. That's a little scary to think about, but it's something that is okay because it just means that things are kind of draining from the inside, which is kind of what we want. We don't want blood products to necessarily stay up there. And then after surgery, you want to kind of take it easy because those stitches that are holding that muscle to the foot plate are very fine stitches. And if you really, bear down or do anything that's going to raise a lot of blood flow to your face, that can potentially cause the stitches to break, in addition to the, possibly knocking into something or playing a contact sport. Those are the kind of things you want to avoid after surgery. There are some celebrities that have ptosis. If you think Michelle Obama has one eye that's just a little bit lower, Paris Hilton has one eye that's a little bit lower. Forrest Whitaker is another example, a little bit more dramatically lower eyelid. And it's not something that necessarily makes somebody not look aesthetically pleasing. It's just that it might give asymmetry to the eyelids. And whether you want that or not is kind of a personal choice. The last question that I often get asked after surgery is, can ptosis come back after surgery? And if so, can it be treated again? And unfortunately, the answer it can come back. Sometimes we have to repeat ptosis surgery. It's more common to repeat ptosis surgery in that situation I talked about before, where somebody is born with a droopy eyelid, like a congenital droopy eyelid. In that case, you're almost guaranteed to have more than one surgery throughout the course of your life. I hate to say it. If you're not in that category, though, usually ptosis surgery goes well without you having to repeat it. But over time, that muscle can kind of wear its way off of that foot plate again, and then things can drag. Sometimes that happens a few months after surgery. Sometimes it happens decades after surgery. It just really depends. But the good news is that ptosis surgery can be repeated. It's not something that once you do it, you cause a lot of scar tissue in there and you can't go in there again. It's actually very common in my practice and in colleagues of mine's practices to take care of patients who have had multiple ptosis surgeries, and then they come to me and we can still fix it. So don't lose hope. If it has come back or if you've had ptosis surgery and it droops again, just get another opinion. You might be surprised that you can actually fix it again. If you have any questions about ptosis, please leave them in the comments. I'd be happy to answer them. And if you're looking to find out more about eyelid surgery, visit our website at eyelidcenterutah.com and consider subscribing to our channel, and we have more information on eyelid surgery.